Hello, Dr. Castrucci. I am Gabriel Ifergan from the social media team of PVI 2024, and I currently work in Amiens in France. And I let you introduce yourself.
So, hello, my name is Tommaso Castrucci. I'm a vascular surgeon. My practice is in Santa Eugenia Hospital in Rome. And in the last decade or so, I have been strongly focused on carotid artery stenting, and particularly in seeking the methods and the materials to make this procedure as safe as possible.
Okay, and I'm very pleased to welcome you today to discuss about this topic regarding carotid surgery. There are many questions today surrounding open surgery versus stenting, as well as new technologies for stroke prevention during surgery. So let's talk about that. So my first question is, in your opinion, what are the indications for and developments in both CAS and open surgery, and are they distributed between the two techniques?
Yes, first of all, I don't think it is right to say carotid artery stenting versus endarterectomy. That's the open surgical procedures, because both these procedures can find their perfect field of application in different patients with different anatomical situations. And regarding the development of the two procedures, the endarterectomy is a very mature method of treating carotid artery stenosis, and it's been active since the late 50s of the 20th century. So it's got excellent results, but in the last years we haven't seen them becoming better in time, just because it's a mature procedure. While stenting procedure, or CAS as it's better known, has seen a very, very rapid development in the past 15, maybe 10 to 15 years, with the development of new materials, of new strategies, of new techniques. So today, they're probably equivalent in terms of results if you consider them from a general point of view, though they excel in different fields and different sorts of patients. And this is particularly due to the development of new methods and new materials in stenting procedures. And from my point of view, in the later years, I have the proportion of patients treated with open procedures and CAS procedures is about 20 to 80. So it has just turned around if compared to 10 years ago.
Yeah, certainly.
That's my personal practice. Obviously, I don't mean that's the global point of view.
Okay, thank you. And what technical advances have been made in specific devices designed to prevent stroke today?
So I think there's two different categories. One is the stent per se, and one of the procedures we use to position the stent in the carotid artery. And particularly in this second field, the development of new cerebral protection devices has seen a very, very rapid advancement. And because if you compare the two techniques, at the end of the day, what was in favor of endarterectomy was that during the stenting procedures, you have generation of microemboli that could give minor strokes. So the focus is on reducing the possibility that this happens by access routes and protection device. On the other hand, the stents have seen a very, very rapid development. The first stents that were used in these procedures were common stents that were used in other districts. Then we saw the closed cell stents appear, and now we've got double mesh stents.
Okay, so it's about the same question, the third question that I have it. But what are the developments in terms of stents and procedures to prevent stroke and also to prevent restenosis?
So let's talk about the procedures first. So protection devices, the most commonly used protection devices were filters, but these filters have got some shortcomings. First of all, because you've got to cross the lesion before you activate the cerebral protection, and you're never sure your filter will block all emboli going to the brain. So proximal protection strategies have been developed, and probably MoMA is the most known of these strategies, and it consists of a sort of surgical clamping of the bifurcation, so there's no flow, and being there no flow, nothing can go up to the brain. And in my center, we have developed another strategy that's always a proximal protection strategy, probably simplified when compared to MoMA, and this is a flow inversion protection strategy. Both these procedures have shown to be capable of reducing the incidence of microembolizations happening during the procedure. The other chapter is the stents, and nowadays we've got 2 double mesh stents on the market, probably a third one appearing at the horizon, but I personally haven't seen it yet. And these 2 devices differ quite a bit one from another. One is the Seaguard by Inspirement MD, and that's an open cell metal stent, nitinol stent, covered with a micronet of polyethylene. So it's not the classical metal stent, it's a sort of plastic net, very, very, very fine net that prevents the prolapse of the plaque and the degeneration of microemboli. The other is the Road Saver, also known as Casper by Medtronic, and that's also a double mesh stent. The difference between the two is that this second one is completely metallic, and the porosity is slightly higher than the Seaguard, though I don't think this is a real issue.
Okay, so we understand that new technologies are increasing in terms of CAS to perform this procedure safely. Next step maybe is to do more randomized controlled trial and develop the training of vascular surgeon with those devices. So I would like to thank you, Dr. Castrucci, for this interview, and see you next time at the PBI.
I'm looking forward to it. I'm really looking forward to it, to meet you and all the group of PBI. Thank you very
much.
Charles.
Thank you.